Good afternoon, everyone. Welcome you all to the second series of live phone-in program organized by Telecenter for Person with Communication Disorder, All India Institute of Speech and Hearing, MYSURU. I am Dr. T. Jayakumar, working as Associate Professor and Head Department of Speech Language Sciences, AIISH. I will be moderating this program for the today's session. The All India Institute of Speech and Hearing is a premier institute and it is popularly known as AIISH, and it is under the Ministry of Health and Family Welfare, the Government of India. This month, that is the July, is the month of Cleft Lip and Palate Awareness Month. As a part of that, we are organizing this program. And every year, around 35,000 children are born with the cleft lip in India, and majority of them are unable to seek medical help due to unawareness and also the lack of facilities. Today's program will be focusing on building awareness in the general public in terms of assessment and the management of cleft lip and palate. Today we have two experts with us. They are the resource person for the today's program, and we have many questions to ask them, and also you can ask many queries regarding the same. We have with us Dr. Satish HD. He's a consultant plastic surgeon, Unit for Structural of Orofacial Anomalies, Department of Speech Language, Department of Clinical Services, All India Institute of Speech and Hearing. And he has a extensive experience in treating maxillofacial anomalies and reconstruction surgeries. He is associated with AIISH for more than 2 decades. I welcome you, Dr. Satish.
Thank you.
We also have a Dr. Gopi Shankar. He is a speech language pathologist and also a research officer at Unit for Structure of Orofacial Anomalies, Department of Clinical Services, AIISH. He also has extensive experience in terms of clinical and research in assessment in management of cleft lip and palate. I welcome you, Dr. Gopi Shankar.
Thank you, Dr. Jayakumar.
We have a special guest today with us, that is Mr. Karthik. He is working as an IT professional currently, and he is also as a person with a cleft lip and palate. He has joined us with us to give his experience and also his entire journey as a person with cleft lip and palate. Remember, this is a live program and our resource persons are here with us to answer all our questions. You can reach us by dialing the number 0821 250 2530. This number also is displayed on the screen. I welcome you all again to the program. Let's begin the program. Okay, so to begin with the program, I pose the question to Dr. Gopi Shankar, that is, can you please brief us about cleft lip and palate?
Okay.
In a more brief manner.
Okay. When we talk about cleft lip and palate, we should first understand what is normal and what is abnormal. Okay, normal is if you see somebody's face, that gives a first impression about the person, how he is appearing. Okay, so this doesn't happen outside, it happens at mother's womb. Usually the face structure, that is, we are only focusing on face and cleft lip and palate. It starts from 3rd week to 7th week, it starts developing. So when we say cleft lip and palate, in colloquial term, if we say there is a gap in the lips born during the birth, or if it is extended up to the palate, that is inside the mouth. Okay, it can happen in both the sides or single one side only. Usually it is a congenital deformity. Okay, when the baby is born, it happens in the mother's womb itself.
Okay. So we have got some information about the cleft lip and palate. We'll now get into more information about the causes for the cleft lip and palate. We'll get the information from Dr. Satish.
Yeah, this is the commonest question that everybody asks. Why did my child get this cleft lip? Why did my child get the cleft palate? What did we do wrong? Is there anything specifically we can do to avoid this problem from happening next time? These are the questions that are posed to me. The truth is, we really don't know why a cleft lip and cleft palate happens unless there is already a proven genetic issue in the family. In the sense, if there are some problems with the genetic makeup, then we can say more confidently that the children are more likely to have cleft lip and palate. Otherwise, this can happen spontaneously without any known reason, which is usually the cause in more than 90% of the people who have this cleft lip and palate. So, at the end of the day, we know that it is more likely if there is deficiency in the nutrition of the mother. We know it is more likely in people who have poverty. Both are anyway associated with each other. We know it is more likely if the parents have cleft lip and cleft palate, but beyond that, scientific knowledge is not clear on why exactly it happens.
So having known the reason, can we detect before the child born? Do any of the scan or anything? Is that possible, doctor?
Yeah. Nowadays, a lot of people, ladies who are pregnant, undergo an ultrasound scan. Usually once it happens at 3rd month, but more commonly 5th month and another at 7th month. Now in the normal scans, all that the radiologist will be looking for is to find out if the skull and brain are developed, the spinal cord is well developed, and if the heart is working well. And they also measure the length of the leg to know whether the bone development is okay. Now this is what is called as a normal scan. Some of the radiology centers offer what is called as the anomaly scan. That means they sit and look for all the other problems, which takes a long time. What we must all remember is that the child sitting in the mother womb is not sitting quietly. It is not posing for a photograph. So most of the time the child will have its leg folded, its hand will be like this, head will be down like this. And for all we know, the child may be facing the back also. So during the scan, the radiologist has to wait for the child to turn towards the ultrasound machine, lift up its head, open its mouth and yawn. Only then they can see inside the mouth to see if there is a cleft palate. So it's not easy. Takes a lot of time, patience, and sometimes luck also for them to catch it. So that's the only way we can make out whether there's a cleft palate and a cleft lip in the child. Genetic analysis is not done routinely because we don't even know which are the specific genes which can cause. There are so many genes which can cause it. So it is not routinely recommended for scanning to find out whether the child will get cleft lip or cleft palate.
Okay. Yes, thank you, sir. So we'll go back to Mr. Karthik. Karthik, can you hear us?
Yes, I can.
Yeah. So can you just briefly introduce yourself?
Yeah, hello everyone. My name is Karthik, and I am a person who born with a cleft lip and palate, and I took birth in 1985, and from that time only it was by birth the cleft lip and palate observed, and thanks to my parents and also AIISH, so that it was recognized in the early stage, and the necessary surgery and also the speech therapy, everything went well in my case, and that is the reason I am here today in front of you all to create the awareness on how this can be easily handled. So I thank you very much for once again giving this opportunity to AIISH and also making my life a bit very happier.
Okay. Thank you for your brief introduction, Mr. Karthik. You stay with us. We'll come back to you soon. Now,
Sure.
can we move to the Dr. Gopi Shankar? I'll propose you some question that will the person with a cleft lip and palate able to eat and drink without any difficulty? Is that normally possible?
See what happens, the young parents, okay, they would be expecting a normal baby. So as soon as they see the baby and with a facial deformity, what happens?
Can you just hold on? Can you pick the call? Hello, can you hear me? Yeah, can you tell your name and introduce yourself?
Okay, sir. My name is Shruti.
Yes, Shruti. Okay.
Sir, I just wanted to know that one of my cousins has left and they just are planning for a baby, like it's 2 weeks of gestation. So is there any chances that their baby is also having issues like that?
Okay. So you mean to say how much is the chance of for the coming generation to have the cleft lip and palate?
Yeah, exactly. Is there any chances like, and also like before the delivery, can we identify that anything like that?
Yeah, yeah. Okay. So we will pose that question to Dr. Satish.
Yeah. Basically, if the parents have got cleft lip or cleft palate, that means there is a higher chance than normal for the child also to get a cleft lip and cleft palate. But higher chance does not mean 100% chance. The only way we can make out now is to wait for the 3rd month or possibly up to the 5th month. On 3rd month, you can request the radiologist to do an anomaly scan. That means they'll specifically look for this, but sometimes it may not be possible to see at the 3rd month. Based on that, you can come to know whether the child's lips are normal or palate is normal. Those things, it is possible that you can find out.
Okay.
Okay, you'll have to.
Around the 3rd month, right?
Minimum is 3 months. But then the development of different children is at different speeds. So 5th month, everyone can make out. 3rd month, you can give it a try.
Okay, sir.
Thank you.
Thank you, sir. Thank you.
Okay. Thank you, Shruti. Okay. Continuing with the previous question that feeding issue or eating and drinking problem with the children with the cleft lip and palate.
Yeah, Jaikumar, I was just talking about, the young parents. As soon as they see the child with the facial deformity, there will be a huge emotional trauma, okay, even the mother and the parents or the entire family. Okay, so what happens, the moment next thing comes is you have to feed the baby. Okay, that is where all starts about the treating babies with cleft lip and palate. Okay, definitely the child or neonate who's having the cleft lip and palate, he or she will have issues in feeding itself. That as soon as they're born, there will be an issue. Okay, so how it is usually it is done is it will be done by a nurse, or there is some specialist called lactational specialist who will be available. Currently nowadays they are available in the hospital, or a speech language pathologist who can teach. Or if these people are not available, the surgeon, sometimes the surgeon itself, they will be a first person who will give guidance to the mother how to feed a baby. Okay, so those things, from where it starts, actually the treatment starts from as soon as the baby is born. Definitely they'll have issue in feeding and eating.
Okay.
Yeah, can I add something over here?
Yes, yes.
See, in spite of the availability of a lot of knowledge and resources, for some reason, a lot of hospitals and this thing, doctors also are not completely aware that a child with left palate can feed directly from the breast. So they take the easy route out of saying that stop breastfeeding and start formula feeding. So these children are brought at the 1 month, 1.5 month age to me, where each time the mother is no longer producing milk. The valuable opportunity is lost. So today everybody has internet, and obviously everybody is listening to this program also has internet. We just have to search for feeding a child with cleft palate on internet, and there are very educative videos telling you exactly how you can breastfeed a child with a complete cleft palate and feed it, and how to take care of it after the feed, how to make sure that it belches and removes all the air so that it grows up as normal as any other child. So that's very important thing for all of us to be aware, that you don't need to stop breastfeeding a child just because the child has a cleft palate.
Okay, sir. So as soon as the child born with the cleft lip and palate, definitely the parents undergoes emotional stress. And soon after seeing the child, they will first think that what steps to take to correct that particular cleft lip or the palate. So that brings the question that what is the right time to go for a surgery for the cleft lip and palate? Maybe soon after the child born, or maybe later. That can you answer that question?
Yeah, whenever a child with a cleft lip and a cleft palate comes to us, we call it as a reconstructive rehabilitation program, which extends till the child is 18 years old. So the parents have to know about this entire schedule in the beginning itself, which means the first 3 to 6 months is spent in making sure the child grows normally, nutrition is taken care of, immunization is taken care of. Cleft lip surgery is generally done between 3 months to 6 months depending on how good the facilities are. At 3 months, we'll need to do the surgery in a place which has got good neonatal intensive care. That requirement reduces at the age of 6 months. Palate surgery can be done anytime between 9 months to 18 months. It is not that it cannot be done after 18 months, but a lot of research says palate surgery is done after 18 months, the speech results are not so good. Following this, in places like AIISH, there is a facility of early speech therapy, but this facility may not be available everywhere else, in which case at around 2 years of age, speech therapy can be started. At 4 years, we need to do a reassessment whether the speech is good, whether the cleft palate surgery is effective and sufficient. Suppose it is not efficient and good enough for others to understand, this is the time we suggest a second corrective surgery to make the speech better before the child goes to school. The next point comes at around 8 years of age when the milk teeth fall off and the permanent teeth comes up. So that is the time we have to be more careful. Throughout the growing period up till 18 years, the child has to go and see a dental specialist every 6 months because these children tend to have more issues with their teeth. They may also need to go and meet the ENT specialist because they have a higher chance of ear infection and they have to get their hearing confirmed frequently. If their permanent teeth are coming around 9 years of age, then another surgery is done to make sure there is enough bone through which the tooth can come. The next point we'll have to think about is between 15 to 18 years of time when the development is complete. Sometimes around the 9th or 10th year, the girl child especially will come and say the lip is not looking good, or it may be a boy also says my appearance is making me the object of some fun, at which time we may do a corrective surgery for the lip also. Otherwise, the formal surgery for making the lip, the nose and the cheeks look good is generally done at the age of 18 years after the development is over. So this is what we call as the reconstructive program, which the child and the parents have to be aware of in order to reach our goal of the child becoming a normal person in society.
Okay. Next question will pose to Dr. Gopi Shankar. So how long the speech therapy will take for getting rehabilitation for the person with cleft lip and palate?
See, how long, when we talk about how long, sir, when he was talking about when to do surgery, so he has, given almost, up to, 9 months to, he talked about up to 14 years.
Yes.
So when we talk about speech therapy, how early we catch the child, okay? So how early if you do the catch the child, for example, as soon as the surgery is in, sir said 2 years, okay, 2 years when we catch the child, if there is no problem at all in terms of speech language development, then the child is almost normally it is developing. We don't have to worry about. Okay, if there is a delay in speech language development, that's where the early intervention of speech language, therapy is required. SLP plays a major role in development of speech language skills. Okay, that's around 2 years, 2 years or 2.5 years. We need to start off with a therapy program, intervention program. Okay, so if that is not happening, 2 years of age, and the surgery is not done, child is got it surgery done on a later stage. Okay, what happens? Almost some amount of speech would have been developed. Okay, so again we have to see whether how is the language level is, whether only the child is having a speech problem or language issues. If the language related issues are there, then we need to combine and go for both speech and language intervention strategies when we have children with speech cleft lip and palate. Okay, If that is done, only the error is there, only speech problem is there. If you see most of the children with cleft lip and palate, they'll be having, they'll be speaking through their nose, or it is called as hypernasality. Okay, we call it as a resonance disorder. Okay, articulation and resonance disorders. Okay, so we have to go for two different things. One is correcting the articulation. They would be, producing it wrongly. Okay, again, when we say articulation error is happening because of their, mislearned behavior. Because there is a cleft, they would have, learned to articulate different way. Once the surgery is done, we have to make them to relearn the production what they have learned. So there again we do articulation therapy, mainly articulation therapy strategies. We use it and you do it. If there is no anatomical issues in cleft lip and palate, if there is an anatomical error which cannot be corrected through speech therapy, again we would recommend them, and we should tell them to meet the respective surgeon so that those things can be corrected. Okay. So once that is done, if the surgery is successful,
You just wait for, you can take the call. Hello, can you hear us? Hello? Yeah, can you hear us? Can you introduce yourself? ಮೇಘ ಅಂತನಾ? ಓಕೆ, ಎಲ್ಲಿಂದ ಮಾತಾಡ್ತಿದ್ದೀರಾ?
ಬ್ಯಾಂಗ್ಳೂರು.
ಓಕೆ, ಹೇಳಿ, ನಿಮ್ದು ಏನು ಕ್ವಶನ್, ಏನು ಡೌಟ್ ಇದೆ?
ಕಸಿನ್ ಮಗುಗೆ
ಓಕೆ
2 months ಬ್ಯಾಕ್ ಫೀಲ್ಡ್ ಟೀತ್ ಅಂತ ಹೇಳಿ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಆಗಿದೆ ಆಲ್ರೆಡಿ ಸರ್ಜರಿ.
ಓಕೆ
ಇವಾಗ ಅವ್ರಿಗಿನ್ನ ಮಾತಾಡ ಕಷ್ಟತೆ ಏನು ಬರ್ತಾ ಇಲ್ಲ. ಸೊ ಇವಾಗ ನಾವು ನಮಗೆ
ಓಕೆ, ನಿಮ್ದು ಮಗು ಕಸಿನ್ ಮಗುದು ಎಷ್ಟು ವಯಸ್ಸು? 5 months ಇದೆ. ಓಕೆ, ಸೊ 5 months ಅಲ್ಲಿ ಸರ್ಜರಿ ಮಾಡಿದ್ದಾರಾ?
ಹಾ ಸರ್, ಮಾಡ್ತಿದ್ದಾರೆ. ಈಗ 2 months ಆಗಿದೆ.
ಓಕೆ,
ಸೊ ನೆಕ್ಸ್ಟ್ ಏನ್ ಮಾಡ್ಬೋದು?
ಓಕೆ, ಕ್ಯಾನ್ ಓಕೆ ಶಂಕರ್ ಯಾವ ಅಂತದ್ದು ಕ್ವಶನ್?
ಯೂಶಲಿ 5 months ಅಲ್ಲಿ ಸರ್ಜರಿ ಅವರು ಆಗಿದೆ ಅಂತ ನೀವು ಹೇಳ್ತಾ ಇದ್ದೀರಾ. ಯೂಶಲಿ ನಾರ್ಮಲ್ ಮಗು ಅಂತ ನಾವು ತಗೊಂಡ್ರೇನೆ ಮಗು ಮಾತಾಡಕ್ ಶುರು ಮಾಡುವುದು 9 ತಿಂಗಳಿಂದ ಮಗು ಮಾತಾಡಕ್ ಶುರು ಮಾಡುತ್ತೆ. ಸೊ ಮಗು 9 ತಿಂಗಳಿಗೆ ಮಾತಾಡಕ್ ಶುರು ಮಾಡುತ್ತೆ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ತಾಯಿ ತಂದಿರೋ ಮನೆಯಲ್ಲಿ ಇರೋರು ಯಾರು ಸುಮ್ಮನೆ ಇರಲ್ಲ, ಮಗು ಜೊತೆ ಮಾತಾಡ್ತಾ ಇರ್ತಾರೆ. ಅದನ್ನ ನಾವು ಏನಂತ ಅಂದ್ರೆ ಸ್ಪೀಚ್ ಸ್ಟಿಮ್ಯುಲೇಷನ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಮಗು ಮಾತಾಡದೇ ಇದ್ರೂ ಮಗು ಜೊತೆ ನಾವು ಕಮ್ಯುನಿಕೇಟ್ ಮಾಡ್ತಾ ಇರ್ತೀವಿ, ಅದೆಲ್ಲ ಕೇಳಿಸ್ಕೊಳತ್ತೆ. ನಾವು ಮಾತು ಅಂದುವಾಗ 2 ರೀತಿ ಇರುತ್ತೆ, ಒಂದು ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋದು, ಇನ್ನೊಂದು ಮಗು ಮಾತಾಡೋದು. ಓಕೆನಾ? ಸೊ ಅದು ಮಗು ಮಾತಾಡೋದನ್ನ ನಾವು ಸ್ಪೀಚ್ ಸ್ಟಿಮ್ಯುಲೇಷನ್ ಥ್ರೂ ಒಂದೊಂದು ಕಾನ್ಸೆಪ್ಟ್ಸ್ ಹೇಳ್ಕೊಡ್ಬೋದು. ಮಗು ಎಳೆದಿರೋದ್ರಿಂದ ಸ್ಪೀಚ್ ಸ್ಟಿಮ್ಯುಲೇಷನ್ ಮಾಡೋದ್ರಿಂದ ಏನ್ ಮಾಡ್ಬೋದು, ಮಗು ಬೆಳೀತಾ ಬೆಳೀತಾ ಮಾತು ಬೆಳವಣಿಗೆಯನ್ನು ಚೆನ್ನಾಗಿ ಮಾತಾಡೋಕೆ ಕಲ್ತ್ಕೊಳತ್ತೆ. ಸೊ ಆದಷ್ಟು ಅದನ್ನೇ ಏರ್ಲಿ ಇಂಟರ್ವೆನ್ಷನ್ ಪ್ರೋಗ್ರಾಮ್ ಅಂತ ನಾವು ಮುಂಚೆ ಹೇಳ್ತಾ ಇದ್ವಿ. ಎಷ್ಟು ಬೇಗ ನಾವು ಮಗುಗೆ ಹೇಳ್ಕೊಡಕ್ಕೆ ಶುರು ಮಾಡ್ತೀವಿ ಅಂತ. ಕೆಲವು ಸ್ಟ್ರಾಟಜೀಸ್ ಎಲ್ಲ ತಾಯಿ ತಂದೆಯರಿಗೆ ಹೇಳ್ಕೊಡ್ತೀವಿ. ಯಾರಾದ್ರೂ ಸ್ಪೀಚ್ ಥೆರಪಿಸ್ಟ್ ಇದ್ರೆ ಅವ್ರ ಹತ್ರ ಹೋದ್ರೆ ಅವರು ಸ್ಟ್ರಾಟಜೀಸ್ ನಿಮ್ಗೆ ಹೇಳ್ತಾರೆ, ಏನ್ ಮಾಡ್ಬೇಕು ಮಗು ಜೊತೆ, ಏನೇನ ಅಬ್ಸರ್ವ್ ಮಾಡ್ಬೇಕು, ಏನಾದ್ರೂ ಡಿಲೇ ಇದ್ರೆ ನೆಕ್ಸ್ಟ್ ಯಾವಾಗ ಬಂದು ಭೇಟಿ ಆಗ್ಬೇಕು ಅಂತೆಲ್ಲ ಅವ್ರು ಹೇಳ್ತಾರೆ. ಸೊ ಯು ಶುಡ್ ಸ್ಟಾರ್ಟ್ ಅಪ್ ವಿತ್ ಅರ್ಲಿ ಇಂಟರ್ವೆನ್ಷನ್ ಪ್ರೋಗ್ರಾಮ್ ನಿಮ್ಮ ಕಸಿನ್ ಮಗುಗೆ.
ಸರ್, ಇನ್ನೊಂದು ಪ್ರಶ್ನೆ ಇದೆ ಇಲ್ಲಿ. ಯಾರಾದ್ರೂ ನಿಮ್ಮ ಆ ಮಗುಗೆ ಕ್ಲೆಫ್ಟ್ ಪ್ಯಾಲೆಟ್ ಅಂದ್ರೆ ಒಳಗಡೆ ಕ್ಲೆಫ್ಟ್ ಇದೆ ಅಂತ ಹೇಳಿದಾರಾ?
ಅಷ್ಟು ಐಡಿಯಾ ಇಲ್ಲ.
ಅದಕ್ಕೆ ಫಸ್ಟ್ ಅದನ್ನ ತಿಳ್ಕೊಳ್ಳಿ. ಯಾಕಂದ್ರೆ ಮಾತಿಗೆ ತುಟಿದು ಅಷ್ಟೊಂದು ಕಾಂಟ್ರಿಬ್ಯೂಷನ್ ಇಲ್ಲ. ಸೀಳ್ ತುಟಿ ಇದ್ರೆ ಮಾತು ಬರಲ್ಲ ಅನ್ನೋದು ದೊಡ್ಡ ಸುಳ್ಳು. ಸೀಳ್ ತುಟಿ ಮಾತ್ರ ಇದ್ರೆ ಮಾತಿನ ಬೆಳವಣಿಗೆಗೆ ಯಾವುದೇ ರೀತಿ ಪ್ರಾಬ್ಲಮ್ ಆಗಬಾರ್ದು. ಬಟ್ ಒಳಗಡೆ ಕ್ಲೆಫ್ಟ್ ಪ್ಯಾಲೆಟ್ ಅಥವಾ ಸೀಳು ಅಂಗಳ ಏನಾದ್ರು ಇತ್ತು ಅಂದ್ರೆ ಆವಾಗ ಅದಕ್ಕೆ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೋಬೇಕಾಗತ್ತೆ. ಅದನ್ನ ಫಸ್ಟ್ ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಳ್ಳಿ.
Okay, thank you. So the previous question we were discussing that how long the speech therapy will take. Generally, that is depends on how early the surgery is being done, and based on that, the treatment procedures for speech therapy will vary. So that's what Dr. Gopi Shankar has highlighted.
There's one point I would like to add over here.
Yes, sir.
A lot of parents will come to me and say, Why should we go to a speech therapist for speech therapy? Why can't we teach the child at home?
Okay.
So they have the feeling that just by talking to the child, they can make the child speak normally. I would like to mention here that to give speech therapy to a child, these experts undergo a lot of training, they have a lot of experience, and it's a complicated issue which may appear simple to you. I tell everybody this is the same thing like, why can't you train and educate your child at home instead of sending to a school? Theoretically, it can be done. But what is the end result? In the same way, it is very essential to go to an expert in that subject if you want the best outcome. So don't try to compromise on that and say that I have to travel half an hour, I have to do this, I have to take leave. So this is a very critical part for a child with cleft palate to talk normally. 50% is surgery, 50% is speech therapy. So unless you concentrate on both the halves, the child is not going to speak well. So don't try to give home speech therapy the way you know or the way you have learned from the internet probably.
Yes, sir. Thank you, sir. And maybe we'll hear from Mr. Karthik only, so that will be more appropriate. Karthik, can you hear me? Hello? Karthik, can you able to hear us? Can you switch on your mic? Yeah, you can talk, and you can also switch on your video.
Yes, I did.
Yeah. So can you just tell about your how the cleft lip and palate has identified or impacted in your life? Can you tell about your journey till you get rehabilitation from AIISH? Karthik, can you able to hear? Hello? Okay. Okay, we'll come back to him later. So next, as we are aware that the cleft lip and palate is causing a speech problem, and more of the time we can consider that one as a speech impairment. So whether any possibilities for the children or the adults with the cleft lip and palate to get a certificate or to consider them as a speech disability?
See, in still 2016, there was no such
Can
provision.
you just hold on for a minute, sir? Hello?
Hello?
Yes, can you tell me? Any
Yeah. Sir, I have a question. There is a 10-year-old girl
Okay.
Yeah, sure. I'm not sure. Am I audible?
prepared, but still she is having
Yes, am I audible? Am I audible?
Yeah, 1 minute, Karthik. We'll come back to you. Yeah, madam, if you
Yes,
can.
am I audible?
Yes, you are audible, Karthik. We'll just come back to you in a
Hello,
minute.
am I audible to you all?
Yes, Karthik, we are able to hear you. Can you just hold on for a minute? Hello, madam, are you in the line?
hello? Yes.
Yeah, can you continue your query?
There is a 10-year-old girl
Yes.
who's had a history of cleft lip and palate and has gotten it repaired now.
Okay.
But still there is complaint of like liquid and food coming out of the nose.
Okay.
So what can be done in that case?
Okay, so to correct the feeding issues, can you highlight on the rehabilitation procedure?
I think what our question was, even after the surgery, the food is coming through the nose.
Yes.
Okay.
So basically, here the question is two parts. One is it only food which is coming out, and what is the speech of the child like, because these two cannot be separated. If food is escaping when she swallows, it's likely that air is also escaping, and therefore the speech is not good. Which means basically that the palate functional result is not adequate. Now, when you get the child for an assessment, we not only concentrate on the food coming out, but on the speech. So, if we find out that the child has got a nasal escape, which we classified as mild, moderate, or severe, based on there are some machines which will take this measurement. There are people who will look at it. If it is mild, just strengthening those muscles by certain exercises will take care of this problem. But if it is moderate or severe, we have to do further investigation to find out what is the exact source of the problem, and it's possible that one more operation or surgery may be required to stop this from happening. I hope that answers your question.
Yes. Thank you.
Yes, thank you. So, Karthik, can you able to hear me? Okay. So continuing with the previous question, whether the speech impairment in cleft lip and palate, can that be considered as a speech disability?
Yeah, I was just telling you about in 2016 there was a provision made in Government of India. Children or adult with cleft lip and palate can be considered under the category of disability. Okay, they have revised the entire disability criteria, and they have included cleft lip and palate, that is maxillofacial anomaly, under a speech impairment or speech disability, and they are eligible to get certificates as a disabled certificate. Again, that needs to be verified by a specialist, and it can be done at All India Institute of Speech and Hearing or a nearest government hospital, wherever it is available. This facility is available. They can get disability certificate.
Okay. So based on the degree or the degree of extension, we can see that whether percentage of impairment they will be deciding about the disability.
Yeah, we need to see the benchmark disability, that is about 40%, whether the problem is above 40%. If they go beyond 40%, it will be considered speech impairment.
Okay.
Now, at this point, I would just like to highlight one more thing. A lot of children who come here will have certain amount of disability. What we would like to inform parents of these children is getting a disability certificate and getting pension or whatever benefits the government gives is one part. But we would like to tell these parents that that is not the end point of taking care of the child. You still need to think of getting the child for speech therapy or possibly another surgery to help the child to speak normally. Because many people, once they get a disability certificate, they leave it alone. But the child, when it grows up, will be alone someday and has to face the society and has to speak normally. Therefore, disability is one part, but rehabilitation is something that has to never be forgotten for a parent.
Okay, thank you. Karthik, can you hear us?
Yes. Am I audible now?
Yeah, you are very much audible.
I'm really sorry. There was some network issue, I think. Now I am good in position. Yes.
Yeah. Can you just describe about your journey through as a person with a cleft lip and palate, what all the problems you faced and how you succeeded?
Sure. So as I mentioned earlier in my introduction, so I born with a cleft lip and palate. After that, I went through the surgery when I was 18 months baby, and that was done in Care Hospital by Mr. Dr. Kundalika Hekle. So then after that, as Dr. Satish mentioned, even I went through a lot of dental issues, and those dental issues were also cured until I was completed my SSLC. Until then, the treatment was done, and because of all treatment and there is at the right time, I could able to recover my speech very well. And now, earlier to these stages, what I have been gone through, now I am feeling totally different. and also very easy in communicating with the people compared to my earlier life. So it's been a drastic change, and also I'm feeling very happy for that, all the help that I received from AIISH.
Okay, to add on to that, Karthik also know that more than 4-5 languages. That tells
Yes.
that person with a cleft lip and palate eventually can succeed over the speech impairment. Yes?
Yes, yes.
What
So
are
the
the social problems
yes,
you
please.
underwent due to the cleft lip and palate, and how to
Yeah.
cope up with that?
Sure. So example, when I was a child, right, during my childhood days, I still remember that people never used to answer to my questions, whatever that I ask. I never used to get the feedback or the answers that what I was expected. Only because they were not at all understanding what I was talking all about. And I was not knowing that they are not understanding it. In the later days, I realized that it is related to my speech itself, that they are not at all getting what I am talking. And then after that, wherever I go, you believe it or not, in my academics also, I was very, very well, and I was a very brilliant student. However, my teachers, they never used to ask me questions, only because I used to give my answers very confidently, and they never used to understand that. So they stopped asking me questions itself. And even when I am going and when I am traveling, I used to face a lot of problems with my speech. Later days, after the speech therapy, I took it very positively, and I dedicatedly completed all the therapy and the suggestions given by all the doctors. And because of that, I am here part of this program today.
Okay, Karthik, stay with us. We'll come back to you.
Yeah, sure.
There is a
Sure.
call coming. We'll come back. Hello? Can you hear us?
Hello.
Heli?
ಕಲ್ಕಡಿಂದ ಸರ್.
ಹೇಳಿ ಮೇಡಮ್.
ಮೈಸೂರಲ್ಲಿ ಆಸ್ಪತ್ರೆ ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ತೋರಿಸ್ತಾ ಇದ್ವು, ಕ್ಲಾಸಸ್ ಕೊಡ್ತಾ ಇದ್ವು.
ಓಕೆ.
ಈಗ ನಮ್ಮ ಮನೆಯವ್ರಿಗೆ ಸ್ವಲ್ಪ ಆಕ್ಸಿಡೆಂಟ್ ಅಲ್ಲಿ ತೋರ್ಸ್ಕೊ ಬರುವಾಗ ಆಕ್ಸಿಡೆಂಟ್ ಆಯ್ತು, ಅದರಿಂದ ಸ್ಕೂಲ್ಗೆ ಹಾಕ್ಬಿಟ್ಟಿದ್ದೀನಿ, ಗೌರ್ಮೆಂಟ್ ಸ್ಕೂಲ್ಗೆ.
ಓಹೋ, ಓಕೆ.
ನಾನು ಹಾಕಿರೋದು ಸರಿನಾ ತಪ್ಪು ಅಂತ ಗೊತ್ತಿಲ್ಲ ಸರ್, ನೀವೇ ಹೇಳ್ಬೇಕು, ಅದಕ್ಕೆ ಮಾಹಿತಿ ತಿಳ್ಕೊಡಿ.
ಏನಾಯ್ತು ನಿಮ್ಮ
ಸ್ಕೂಲ್ಗೆ ಹಾಕಿದಾರಂತೆ? ಸ್ಕೂಲ್ಗೆ ಹಾಕಿದೀರಾ? ಅದು ಸರಿನಾ ತಪ್ಪಾ ಅಂತ ನೀವು ಕೇಳ್ತಾ ಇರೋದಾ?
ಸರ್ ಅವ್ರು ಕೊಡ್ತು ಸರ್, ಅದು ನಾವು ಆಪರೇಷನ್ ಆದ ತಕ್ಷಣ ಕೊರೋನಾ ಬಂತು.
ಆಯ್ತು.
3 ವರ್ಷನೂ ನಮ್ಗೆ ಸರಿಯಾಗಿ ಕ್ಲಾಸಸ್ ಸಿಗ್ಲಿಲ್ಲ, ಕ್ಲಾಸ್ ಕೊಟ್ರು. ಸರಿಯಾಗಿ ಕಲಿಯಕ್ ಆಗ್ಲಿಲ್ಲ ಸರ್. ಇವಾಗ ನಮ್ಮ ಮನೆಯವ್ರಿಗೆ ಆಕ್ಸಿಡೆಂಟ್ ಆಗಿರೋದ್ರಿಂದ ನಮ್ಗೆ ಸ್ವಲ್ಪ ಪ್ರಾಬ್ಲಮ್ ಆಯ್ತು. ಇವಾಗ ಗೌರ್ಮೆಂಟ್ ಸ್ಕೂಲ್ಗೆ ಹಾಕ್ಬಿಟ್ಟಿದೀವಿ ಸರ್. ಸ್ವಲ್ಪ ಅಲ್ಲಿ ಮಕ್ಕಳು ಸನ್ನೆಗಳು ಮಾಡ್ಬಿಡ್ತಾರೆ.
ಈಗ ಮಗುಗೆ ಎಷ್ಟು ವಯಸ್ಸಾಗಿದೆ?
ಅವ್ರಿಗೆ 5 ತುಂಬಿ 6 ಸರ್.
ಆಪರೇಷನ್ ಯಾವಾಗ ಆಗಿತ್ತು?
3 ವರ್ಷ ತುಂಬಿತ್ತು, ಅವಾಗ ಆಯ್ತು ಸರ್.
ಓಕೆ, ಈಗ ಹಂಗಾದ್ರೆ ಒಂದು 1ನೇ ಕ್ಲಾಸ್ ಹೋಗ್ತಾ ಇದೆಯಲ್ವಾ ಮಗು?
ಹೌದು ಸರ್, 1ನೇ ಕ್ಲಾಸ್.
ಈಗ ಮಗುಗೆ ಹೆಂಗ ಬೇಕಾದ್ರ ಮಾತಿನ ಥೆರಪಿ ಅಂತೂ ಬೇಕು. ಓಕೆನಾ? ಮಾತಿನ ಥೆರಪಿ ಬೇಕು. ಈಗ ಸ್ಕೂಲ್ಗೆ ಹಾಕಿರೋದು ಸರಿನಾ ತಪ್ಪು ಅಂತ ನೀವು ಕೇಳೋದ್ರಿಂದ, ಸ್ಕೂಲ್ಗೆ ಹಾಕಿರೋದ್ರಲ್ಲಿ ಏನು ತಪ್ಪಿಲ್ಲ. ಆಯ್ತಾ? ಸ್ಕೂಲ್ಗೆ ಮಗು ಹೋಗೋದು ನಾರ್ಮಲಿ ಹೋಗ್ಲಿ, ಯಾಕೆಂದ್ರೆ ಆ ಮಗು ವಯಸ್ಸಿರೋ ಮಕ್ಕಳ ಜೊತೆ ಅವ್ರು ಬೆಳೆಯುವಾಗ ಅವ್ರ ಮಾತು ಸ್ವಲ್ಪ ಕಲ್ತ್ಕೊಂತಾಳೆ. ಆಯ್ತಾ? ಅದ್ರ ಜೊತೆಗೆ ಅದು ಒಂದೇ ಸಾಲದು, ಅದ್ರ ಜೊತೆಗೆ ಮಗುಗೆ ಮಾತಿನ ಥೆರಪಿ ಅಂತ ಕೊಡಲೇಬೇಕು. ಆಯ್ತಾ? ಅದು ಯಾವಾಗ ನಿಮ್ ಯಜಮಾನ್ರದ್ದು ಇದ್ರದ್ದೆಲ್ಲ ಹೆಲ್ತ್ ಎಲ್ಲ ಸರಿ ಹೋಗುತ್ತೋ ಆವಾಗ ನೀವು ಬಂದು ಮೈಸೂರಲ್ಲಿ ಬಂದು, ಇಲ್ಲಾಂದ್ರೆ ಹತ್ರ ಇಲ್ಲಾದ್ರೂ ಇದ್ರೆ ಅಲ್ಲಿ ಹೋಗಿ ನೀವು ಮಾತಿನ ಥೆರಪಿ ತಗೋಬಹುದು. ಆಯ್ತಾ?
ಅಲ್ಲಿ ಹೋಗಿರೋದ್ರಿಂದ ಅವ್ರಿಗೆ ಸ್ಪಷ್ಟತೆ ಸಿಗ್ತಾ ಇಲ್ಲ ಸರ್, ಅಲ್ಲಿ ಸ್ಕೂಲಲ್ಲಿ ಮೇಡಮ್ ಹೇಳೋದು
ಅದನ್ನೇನೆ, ಅದಕ್ಕೇನೆ ಮಾತಿನ ಥೆರಪಿ ಹೇಳೋದು. ಮುಂದೆನೂ ಸರ್ ಹೇಳ್ತಾ ಇದ್ರು, ಮನೆಯಲ್ಲಿ ಪೇರೆಂಟ್ಸ್ ಆಗಿರೋರು ಹೇಳ್ಕೊಡೋದಕ್ಕೂ ಅದಕ್ಕಾಗಿ ಓದಿ ಸ್ಪೆಷಲಿಸ್ಟ್ ಹತ್ರ ಕಲ್ತ್ಕೊಳ್ಳೋದಕ್ಕೂ ವ್ಯತ್ಯಾಸ ಇದೆ. ಅದನ್ನೆಲ್ಲ ಹೆಂಗೆಲ್ಲ ಹೇಳ್ಕೊಡ್ಬೇಕು ಅಂತ ಅವ್ರು ನಿಮಗೆ ವಿಧಾನಗಳು ಹೇಳ್ಕೊಡ್ತಾರೆ ಮಾತಿನ ಥೆರಪಿಯಲ್ಲಿ. ಅದನ್ನ ತಗೊಂಡ್ಮೇಲೆ ನೀವು ಮನೆಯಲ್ಲಿ ಮಾಡಬಹುದು. ಅದು ತಗೊಳ್ದೆ, ಅದು ಗೊತ್ತಿಲ್ಲದೆ ನೀವು ಮಾಡಿದಾಗ ಅದು ಉಚ್ಚಾರಣೆ ತೊಂದರೆ ಸರಿ ಮಾಡೋದೆಲ್ಲ ಸ್ವಲ್ಪ ಕಷ್ಟ ಆಗ್ಬೋದು. ಅದಕ್ಕೆ
ತಿಳ್ಕೊಂಡು ನಾವು ಕ್ಲಾಸಸ್ ಕೊಡ್ಸೋದ್ರಿಂದ ನಾವು ಸ್ಟೆಪ್ ಒಳ್ಳೆದಾಗ್ಬೋದು ಅಂತ.
ಹೌದು ಹೌದು. ಬೇರೆ ಏನಾದ್ರು ಪ್ರಶ್ನೆ?
ಅದು ಮಾತಿನ ಥೆರಪಿ ಕೊಡ್ಸೇಬೇಕಲ್ಲ ಸರ್? ಇದು ಹಿಯರಿಂಗ್ ಏನ್ ಇಲ್ಲದೆ ಹೋದ್ರು ಅದನ್ನ ಥೆರಪಿನ ನಾವು ಖಂಡಿತವಾಗಿ ಕೊಡಿಸ್ಲೇಬೇಕು.
ಹಿಯರಿಂಗ್ ಇಲ್ಲೇ ಅಂತಲ್ಲ, ಈಗ ಹಿಯರಿಂಗ್ ಚೆನ್ನಾಗಿದೆಯಾ ಅಂತ ಕೆಲವು ಸತಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಸೀಳು ತುಟಿ ಸೀಳು ಅಂಗ್ಲಿರೋ ಮಕ್ಕಳಿಗೆ ಕಿವಿ ತೊಂದ್ರೆನೂ ಇರ್ಬೋದು. ಆಯ್ತಾ, ಆಗತ್ತೆ ಆಯ್ತಾ. ಅದು ಏನು ತೊಂದರೆ ಇಲ್ಲ ಅಂತ ಇಲ್ಲಿ ಬಂದಾಗ ನೋಡ್ಕೊಂಡಾಗ ಕಿವಿ ತೊಂದರೆ ಏನು ಇಲ್ಲ ಅಂದ್ಮೇಲೆ ಮಾತಿನ ಥೆರಪಿ ಕೊಡ್ಬೇಕಾಗತ್ತೆ.
ಏನು ಇಲ್ಲ ಅಂದಾಗ ಇದನ್ನ ಕೊಡ್ಬೇಕು ಅಂತ.
ಹೌದು, ಮಾತಿನ ಥೆರಪಿ ಅಂತ ಕೊಡ್ಬೇಕು.
ಮ್ಯಾಪಿಂಗ್ ಒಂದು ವರ್ಷ ಆಯ್ತು ಸರ್ ಮಾಡಿಸಿ, ಮತ್ತೆ ನಾವು ಹೋಗಿಲ್ಲ.
ಹ್ಮ್
ಮೇಡಮ್ ಕೇಳಿದ್ರೆ ಮೇಡಮು ನಮಗೆ ನಿಮ್ ರೀಸನ್ ಎಲ್ಲ ಹೇಳಂಗಿಲ್ಲ, ನೀವು ಕೊಡ್ಲೇಬೇಕು, ನೀವು ಮಾಡ್ಲೇಬೇಕು ಅಂದ್ಬಿಡ್ತಾರೆ ಸರ್.
ಓಕೆ, ಹಂಗಾದ್ರೆ ಕಿವಿ ತೊಂದರೆನೂ ಇದೆ ಅನ್ಸುತ್ತೆ ಮಗುಗಲ್ವಾ?
ಹ್ಞೂ ಸರ್, ಕಿವಿ ಅವ್ರಿಗೆ ಆಪರೇಷನ್ ಆಗಿದೆ, ಒಂದು ಕಾಕ್ಲಿಯರ್ ಇಂಪ್ಲಾಂಟ್.
ಓಕೆ.
ಇನ್ನೊಂದಕ್ಕೆ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕ್ತಿದೀವಿ ಸರ್.
ಓಕೆ, ಅದ್ರ ಜೊತೆಗೆ ಸೀಳು ತುಟಿ ಸೀಳು ಅಂಗ್ಲೂ ಇದೆಯಾ?
ಚೆನ್ನಾಗಿದ್ದಾಳೆ, ಆಕ್ಟಿವ್ ಆಗಿದ್ದಾಳೆ.
ಓಕೆ,
ಅದರಿಂದ ನಮ್ಗೆ ಭಯ ಆಗ್ತಿದೆ ಸರ್. ಈ ಸ್ಕೂಲ್ಗೆ ಹಾಕಿದೀನಿ.
ಆಯ್ತು, ಅದನ್ನೇ ಯಾವ್ದಾದ್ರು ಥೆರಪಿ. ಈಗ ನಾನೇನು ನೀವು ಮಾತಾಡೋದನ್ನ ಏನು ಅರ್ಥ ಮಾಡ್ಕೊಂಡಿದ್ದೀನಿ ಅಂದ್ರೆ ಅವ್ರಿಗೆ ಕಾಕ್ಲಿಯರ್ ಇಂಪ್ಲಾಂಟ್ ಮಾಡಿದೀರಾ ಒಂದ್ ಕಡೆ ಕಿವಿಗೆ,
ಹಾಂ ಸರ್.
ಇನ್ನೊಂದ್ ಕಡೆ ಕಿವಿಗೆ ಹಿಯರಿಂಗ್ ಏಡ್ ಹಾಕಿದೀರಾ.
ಹಾಂ ಸರ್.
ನೀವು ಮಾತಿನ ಥೆರಪಿ ಕೊಡ್ಬೇಕಾ ಅಂತ ಕೇಳ್ತಾ ಇರೋದಲ್ವಾ?
ಹಾಂ ಸರ್.
ಮಾತಿನ ಥೆರಪಿ
ಹಿಯರಿಂಗು ಮತ್ತು ಥೆರಪಿ ಮತ್ತು ಕಿವಿ ಥೆರಪಿ ಎರಡನ್ನೂ ಕೊಡಿಸ್ತಾ ಇದ್ವಿ ಸರ್.
ಅದು ಎರಡು ಕೊಡಿಸ್ಬೇಕು. ಸ್ಕೂಲ್ಗೆ ಹೋಗ್ತಾ ಇದು ಎರಡು ಕೊಡಿಸ್ಬೇಕು, ಆವಾಗಲೇ ಉಪಯೋಗ ಆಗೋದು.
ಓಕೆ ಸರ್.
ಇನ್ನೂ ಕೊಡಿಸು ಸರ್.
ಹಾಂ, ಸರಿ ಮೇಡಮ್. ಇದು ಓಕೆ. So continuing with the previous questions, we have seen that client with the cleft lip and palate as mainly the speech problem and also the feeding problem. Apart from that, any other problems that they generally face in their childhood or during the developmental stage? Can we pose that question to Dr. Satish?
Yes, it's actually one part which is totally neglected by all of us, because most treatment facilities are not really tuned for the psychological aspects of what a child with a cleft lip and cleft palate undergoes in normal life. So, as a surgeon, I'll be talking. Speech therapist will give speech therapy, but it's not that within one day the child is going to start speaking normally. And society is not generally very kind to such people or children or the parents. So what we see is by the age of 7 or 8, when they come for follow-up, they are extremely quiet children. Even in our OPDs, they don't open their mouth. Most of the time, some of them have left school because they don't want to face all the jokes that other children make about them. Parents are worried because if they come back, we may say one more operation or speech therapy. They don't have the money for it. So these children gradually slip into one corner. They don't go after education, and psychologically also they get depressed. So this is one of the unspoken problems in cleft lip and palate. That's why I would be very interested, because Karthik was just saying that he assumed that others are not understanding and therefore his confidence improved. But I am sure there are people who would have made fun of him, so we would like to find out how he reacted to it and how he overcame that also.
Karthik, did you hear the question?
Yes, I can take it up. As Satish sir mentioned, yes, I underwent lot of raggings like that, and people make fun out of me and my speech. So the only challenge that I was having is I should somehow make them understand what I want to talk to them, what I want to tell them. So I quickly realized that there is a problem with my voice. It's not about what they're listening, it's about what I'm speaking. So that is how I took it as a challenge, and I'm self-made with my speech improvements along with the therapy that I went through, which helped me a lot. So everyone, if they somehow make their mind to take it as a challenge and accept it, because they this is something which we are our control. So repeatedly going through the therapy, listening to the doctors, following their instructions and all will definitely help. And those who were making fun out of my speech the long back, now they are only watching me, maybe talking in this video also, and they all feel very happy for me and proud that I overcome those challenges.
Okay, so what is your advice for the person with a cleft lip and palate, and also the parents of cleft lip and parents who have the children?
Yes. So one thing I would always like to tell everyone that I meet is, so this is something that we have received already. As a person, cleft lip and palate, as Dr. Satish mentioned, due to so many reasons, this is something that it has come already. The very first thing, we have to accept it. So if you accept it, then you can deal with it in any way, whatever is required for that. So if you don't accept it, and if you look it as a problem itself, then you will never find out the solution for that. So we have to accept that as a problem and consult the right doctors, take the surgery at the right time, go through the therapies, and feel very confident, feel very positive that this is something which I will overcome. This is something that I will correct. So we should have that mindset, and only those things will help and improve the speech.
Yes, Karthik, thank you very much. And it is interesting and also the motivation for the people, your example of overcoming and succeeding in your life with a person with as a person with a cleft lip and palate. Thank you.
Yes, thank you.
Yes, sir. We also ask our resource person or the experts about the take-home message that we can give to the clients as well as to the parents. First, we'll hear from Dr. Satish.
The first thing is, it is really something difficult for any parent to deal with a child who is born with a cleft lip and a cleft palate. It cannot be imagined because every mother and father will be looking forward to what they imagine as the most beautiful child on earth.
Yes, yes.
And then when a child is born with cleft lip, not only their dreams are shattered, they get into depression. But the important thing to know is the problem that they have, which is cleft lip and cleft palate, is a treatable problem. It is not an untreatable problem. That means there is a solution. And at the end of the solution, their child can look normal, can speak normally. And that is how they must take some sort of courage from this whole situation. Today, it is not just about technology or about technique or facilities. We are able to give much better results than, let us say, even 20 years ago. And therefore, people should accept the fact, like Karthik has very correctly said, yes, I have a problem. Yes, there is a solution. Let us get the solution and move on. That should be the attitude so that more children with cleft lip and cleft palate can follow in Karthik's footsteps.
Yes, thank you, sir. So we'll also hear a take-home message from Dr. Gopi Shankar.
Yeah, it's already been highlighted by Karthik and Dr. Satish. Only thing is, it can be corrected. It's never that, it cannot be corrected. Only thing is, you have to follow the timeline and, consult your consultant on a regular basis. Okay, what do they do usually, the parent? Whenever there is an issue or whenever, most of the time our OPD, what we see is there interview in the college, they'll come to us. Is there a marriage fixed, they'll come to us. It should not be in that way. Okay, it should be on a periodical, follow-up. Whenever we ask them to come for a follow-up, at least up to the age of 19, 18 years. So if they are on a regular follow-up, it can be handled and it can be cured. Okay, so regular follow-up with the right people is required. That awareness is really needed for the parents and the persons with individual with cleft lip and palate.
Okay. So thank you to the both the experts. To conclude that, as both of them said, rightly said that with the current technology, that dealing with the person with the cleft lip and palate is relatively facilitated now, and also early detection of the condition is very much important, so that periodically we can follow up and take the right treatment with the right people, So that will solve or reduce the burden more so. Okay. Further, you can also contact All India Institute of Speech and Hearing for more information. You can log on to the website, that is www.aishmysuru.in, for more information and the details. And the institute works between 9 to 5:30 from Monday to Friday, other than the national holidays. If you cannot reach us, we also provide teleservices and tele-rehabilitation through the telecenters. You can get facility through that service also. Thank you, everyone.